Hi, I've got a question. So, if you're a paramedic, do you believe in transporting epipulses? And no, I'm not talking about ROSC, I'm talking about an epipulse. So, basically, an epipulse is when you push epi and you get that fire, right? We see that return. All of a sudden, we get pulses back, but the pulses don't sustain themselves. They're only pulses for about 2 to 3 minutes, and then we go back, we brady down, and then we're back to asystole. I'm not talking about VTAC or VFib, I'm talking brady down to asystole. And do you think you should transport that patient? Should we wait on scene to see if that pulse maintains itself? Or do we, once we get pulses back, immediately transport that patient? I am genuinely curious because I feel like sometimes we are wasting our resources when we are not being able to identify the difference between true ROSC and what I consider to be an epipulse. Because, there are often situations where we're then transporting patients that should have been called on scene, but for whatever reason, right, we did our job, we show up there asystole, we do our job, we do a couple rounds of epi that, whatever round of epi, all of a sudden we get that pulse back. A lot of places, specifically up here, are required to transport the moment that you get a pulse back regardless. And I do not agree with that because I feel like there are situations in which you get an epipulse, right? What I was talking about earlier, where they sustain their pulses for about 2 to 3 minutes. They're probably brady, they're probably very thready, but regardless, they want us to transport, right? Because they consider that a ROSC. It is not a ROSC in my opinion, because I truly feel like in order to maintain ROSC, you have to maintain a pulse for longer than 5 to 10 minutes, and it has to be at a decent rate. I am talking more than at least 30 beats per minute. Okay, that's just my personal opinion. You do not have to agree with me, but I'm genuinely curious. Do you believe that we should be transporting non-ROSC patients or epipulses when we know that realistically that person is probably going to be called once we arrive at the hospital? I don't know. Maybe I'm jaded. You can call me out.